Hi, I'm Tina Ketchie, and I'm here with a very special message for a very special group of people. This message is for medical professionals who really struggle with having difficult conversations with patients about potentially life-limiting illnesses, about dying, about hospice. Loss is hard. Loss is hard for all of us. But for the medical professional who went to medical school to help cure people's illnesses, you feel really uncomfortable having these conversations. I've worked in hospice for 13 years, and I have educated medical professionals at 2 major hospitals as well as 70 physician practices. And I know people avoid doing things they don't feel comfortable doing. And most doctors do not like talking about dying. If you are a family physician who has a large elder population in your practice, if you're a cardiologist, an oncologist, a pulmonologist, a neurologist, if you are a physician that often is faced with having conversations about a life-limiting illness, I am here to tell you that you're going to be doing a lot of that in the coming years. Baby boomers are turning 65 every single day at the rate of 10,000 a day. What that means is you must get comfortable having these conversations because you're going to be doing a lot of it in the coming years. It's just a fact. It's just a reality. Another fact and reality is that you dread having these conversations. You will go to bed at night dreading the conversation you're going to have in the morning. You'll go to bed at night feeling badly about the conversation you had today with that patient and family, just angsting over how uncomfortable you felt and how you couldn't find the right words. And what you really wanted to do is talk about 5 more things we can try to help fix this illness, when in your gut you knew these 5 more tries are simply going to be futile. So you know in your head that everybody is going to die. You know that intellectually. You hate talking about dying. And so my invitation to you today is to get on a phone call with me for 15 minutes. And let's talk about how imperative it is that you get the training that you need so that you not only change that mindset so that you don't feel like a failure because you can't cure the illness. You're not going to have to feel like the patient and family think you gave up on them. So we got to change the mindset about approaching these conversations when somebody has reached that point in life. Number 2, you need to understand what hospice is and what it isn't, and what the 4 levels of care are. You need to understand, can you or can you not have a feeding tube and be on hospice? Be a DNR and be on hospice. All these different things that once you have that information, you are going to feel more comfortable and confident talking about it. And then lastly, you've got to learn how to have these conversations with patients and families so that it comes across in a very compassionate way. They feel like you have them in the palm of your hand, and you're going to walk this journey with them, and you're going to be there to support them no matter what the decisions are that are made. They may decide they want to take the curative path till they draw their last breath. If that's their decision, that's great. If they decide, you know what, I don't think that's what I want, I think I just want to be comfortable, then you're going to feel comfortable and confident helping them down that road. And they're going to know you were there for them every step of the way. And they're not going to sense this nervousness from you. They're not going to feel your discomfort. They're not going to see you sweating and darting your eyes and all this body language that can often come off as, I don't feel like he's present with me right now. Let's get on this 15-minute phone call. Let's talk about how you are going to one day leave fear behind, and you're going to be able to embrace these conversations so that that patient and family know that you have their best interest at heart and you're there for them to support them and surround them with compassion and understanding. So there's a link below this video. I want you to click it and let's get on a phone call.